Well, good morning, everyone. Welcome to our first meeting of September in our new schedule and new cadence of meetings. Before we get started this morning, today is September 11th, and I would ask that we just take a moment of silence and reflection to honor those whose lives were lost on September 11th, 2001. Thank you. All right. We will go right ahead. First of all, I want to introduce, and I believe Mayor Schul may add some additional introduction, but want to introduce the newest member of our task force. We are delighted to have Ms. Chanel C.C. Croxton. And do you go by C.C.? Okay, C.C. Croxton to join us and join our team. So welcome. We are very glad to have you here. And with that, I will turn this over to Mayor Schul and Chair Jacobs for their updates.
I will begin by introducing and saying a little bit more about C.C. Croxton, Katie, and then I'll turn it over to Wendy. As you all know, the Community Engagement Roundtable really wanted us to add a member to the task force who was really close to working people in Durham, essential workers who really knew about their lives and could speak to the COVID-related issues that they were facing on an everyday basis. And Wendy and I considered a number of people. And actually, it was Wendy's suggestion. She said, what about Chanel Croxton? And I said, yeah, awesome idea. And so I'm really pleased that CC has agreed to join our group. CC is the North Carolina organizer for the National Domestic Workers Alliance, also known as We Dream in Black. And I've seen her at work in the movement for the $15 wage, Fight for 15, and really have come to admire her work a great deal. And so I was really pleased when she accepted membership on the task force. And I thought if it would be okay with our chairs that we could ask CC to say a few words about how COVID-19 is affecting the people that she works with on a daily basis. CC, would you do that?
Yes, thank you. Thank you, Mayor Schul, for that introduction. Thank you for having me. Thank you, Wendy, for your recommendation. I really appreciate it and grateful to be here. Yes, I am the organizing director for National Domestic Workers Alliance, and I've been doing this work for about 4.5 years with NDWA, organizing in and around Durham, Raleigh, as well as Charlotte and across the state. And I work with folks who are in the household and folks who do care work. So childcare providers, home care attendants, direct care providers, and house cleaners. And through our We Dream in Black program, we are organizing Black workers. And so my work has centered around working with low-income Black women who do the most important work of, running our homes, and really holding together our communities by providing that really important care work. And, COVID has only increased the issues that we find in the field. These are jobs that are low wage paying, usually no benefits. And so things like a public health crisis really exacerbates the issues that we've seen before, including folks not having paid time off to be able to, care for their loved ones or care for themselves if they are to get sick, as well as, folks putting their lives at risk. These are essential workers who are not able to just stay home. You can't do care work on a Zoom call. And so, a lot of our members have been working since the pandemic came. And so they've had to go out, make sure they keep their clients safe, and themselves safe, and haven't seen any of the benefits of hazard pay, haven't had health insurance during this time, haven't had access to adequate testing and safety measures. And so the things around worker safety and protections are number one, as well as, actually affirming their work by providing the material benefits that are needed. And so we see a lot of, COVID-19 having really drastic impacts on folks, having to really struggle with keeping themselves safe and their family safe, and, figuring out how to, continue this work and fight for the dignity and respect that they so deserve any other time, and especially during now. And so this is really important work to be able to talk about recovery and having a just recovery. And I'm really excited to be able to, represent and, figure out what working people need. I think working people are the most directly hit when it comes to COVID-19. And so definitely don't want to leave working people out of the conversation, and want to make sure that whatever we're passing in Durham, we can be a model for other cities, and make sure that we're putting workers first, as workers make the world go round, is what I say.
Wonderful. Well, we're really glad to have you, and thank you for that background too, and sharing some of the experience. Your perspective and your experience will be really invaluable to this task force and our work. So thank you.
I think that we may have lost Mayor Schewel.
I think we did.
We did.
Chair Jacobs, would you like to pick up?
I'll jump in and just also echo my appreciation for Cece for being willing to serve amongst the many things that she is involved with. You being willing to jump in and also serve in this capacity. And I want to thank Lois and the members of the community outreach, the community roundtable, for really pushing this and urging us to add another person to our task force to give a voice to exactly what Cece will bring, give a voice to the working people in our community. And I mean, not just the working people, but as you said, Cece, the people who literally are taking care of all of us in our community, whether it's, daycare workers or house cleaners or people working in long-term care facilities, people who are working in out on the front line and places that did not shut down in the food industry, all of those critical jobs. So thank you for the work that you do, Cece, and thank you for willing to be a part of this group. So I will just give a little overview. I think everybody is aware that we are now following the governor's order. Okay, Steve is saying, I can hear you and see you, but I can't read the rest of it, but he's obviously having some technical issues. We are now have aligned ourselves with the governor's order and phase 2.5. There are just a few things that we have maintained with our local safer at home order, mostly related to a change that we have in our Unified Development Ordinance that allows for some of the university housing off campus there. And also the other important thing is different with our order is that it allows for civil enforcement of the violation of the order, whereas the governor's order just allows for criminal enforcement. And so ours also allows for civil enforcement, which we think is really important. And I think, as everybody knows, the new order and phase 2 allows for increased mass gatherings. So going up from 10 to 25 indoors and 25 to 50 outdoors, 30% capacity at fitness centers, gyms, studios, museums and aquariums are open at 50% capacity, and playgrounds are open and also long-term care facilities allow for in-person visitation of a limited number in an outdoor setting. I think those are the main things that the executive order allows. But of course, the big thing will be, I guess, as Rod will say, maybe we'll know another week from now, but what the impact is going to be in terms of to our caseload numbers. We're still doing well, and Rob will tell us more about that. The latest numbers from Duke, 2.5% growth rate, which is fantastic. And our 7-day average is 28 when I looked the last time, which was the lowest that we've been since May. And here we are in September now. But we just, of course, want to keep this going. I want to maintain it, even with the increasing in activity, and especially the increase in the mass gathering numbers, because we all know that basically those numbers are allowing social gatherings, people having parties, things like that. And that's where we can see transmission. And so we hope we don't. And of course, a lot depends on the behavior of our students at Duke and NCCU. And we're really hoping that they are still helping us get back on the ball. Other big items are just the state finalized their budget and for the remainder of all of the CARES Act funding. And unfortunately, there are some good things that were allocated funding, but no more local funding for the CARES Act, which is really concerning. $440 million, which was the bulk of the CARES Act funding from the federal government that the state still had to allocate, is being distributed in individual checks of $335 to many families. But the problem is that we have critical needs in our community. We're going to have more budget requests coming out of this task force, and we simply are running out of money at the local level. This has really been a big issue of discussion at our board over the past 2 weeks, and really trying to delve into our finances because we only have about $1.5 million left of local county allocated COVID funding, and we're only about 2.5 months into the fiscal year. So this is something we're going to have to really be strategic and careful about, and really think about how are we going to fund all the really important needs that we have in our community moving forward. So I will stop here and see if the mayor had anything that he wanted to contribute. Okay, there's nothing else here. And
Thank you,
Steve,
Wendy.
can you talk?
Yeah, I'm back.
Back.
I'm sure you didn't miss me, but
Okay.
it took me a while to get on. But I'm glad to be back. The only thing that Ryan asked me to update is the fact that the Durham Delivers, which is the private effort, Susan's involved in it, Susan Amey, Discover Durham, and others, to try to help our restaurants get back on their feet by being able to deliver into neighborhoods and apartment complexes, is hiring a part-time person to support that work and to help organize with the restaurants in the neighborhoods to make those connections. And that position has been privately funded, and so that's going to happen, which is good. And that's my only update. Except I'm sorry I missed the opportunity to say again, welcome to Cece after she finished her remarks. So Cece, we're thrilled to have you.
Great. Thank you both for those updates. So we'll go into our co-chair updates. Maticia, did you want to talk at all about education roundtable, or did you want me to give an update on that?
Sure, I'll talk about the education roundtable. So we had our first meeting September 3rd, and it was a great meeting. Had many members of the task force present. We had North Carolina Central University, North Carolina School of Science and Math, Duke, Durham Tech, DPS. Had a great conversation around the many things that they've done to keep their students safe. It was very encouraging to hear these institutions talk about the variety of things that they've done to keep their students safe. There was a wide range of things that they've done. They talked about things that they're considering doing in the future. So we spent about an hour doing that. We probably could have spent a lot more time having that conversation, but it was great to hear that from these institutions. Our next meeting, we decided that we will meet on a monthly basis. So I think our next meeting is scheduled for October the 1st at 4 o'clock. So if there's any task force members that want to join, please join. I envision that in the meetings, the next meeting and the future meetings, we'll really dive into talking about some of the challenges that some of these institutions may be facing and the ways that we can partner with them as a task force to help them overcome those challenges. But I certainly welcome any feedback from anyone on the task force that sat in on the roundtable. But it was a great session to hear from these institutions.
Great, thank you. Just a quick note on the national eviction moratorium that is now in effect from September 4th through the end of this calendar year, so through December 31st. And that is certainly important to our work here. There's more information that was in the briefing materials. So there's a link there in the briefing materials if you want more information on that. Also, we've had some discussion about between Chair Jacobs, Mayor Schul, Maticia, and myself about beginning to pivot some of our work here. We've done so much work and had so much focus on the immediate public health crisis, and beginning to pivot to really focus on the economic crisis at hand as well. And how do we focus on economic recovery? So have talked with Geoff and Anthony about bringing back on a regular basis, moving forward in probably at our next meeting, bringing back some economic recovery KPIs and reporting out on those briefly at every meeting, just as we do the public health indicators. So more to come on that, but really want to make sure that we are focusing in on that economic recovery, which is so important to the long-term health of our community as well. And that doesn't mean that we're going to do away with talking about the public health, obviously. That's important too, but it's both. And then Nicole, did you want to give us a brief update on outdoor dining?
Sorry. Yeah, I can do that for you very quickly. And I do need to step off at 9 o'clock to have a meeting with the businesses to get their approval for outdoor dining, or their feedback for outdoor dining. The program has changed a little bit from what you all saw 1,000 years ago when we last met, because each day feels like a year to me, probably you all too. So 1,000 years ago when we met, the map has changed quite a bit, and we are trying hard to make sure that this program does not negatively impact any particular business, but that it also serves the purpose of trying to encourage people to come back into downtown and walk through downtown and maintain social distance and visit some of our restaurants and visit some of our retail stores. So while it is very forward-facing a program to help our restaurants, the hope is that it will also help some of our retail. We're looking to close a number of streets. We have a name for it too. It's really original, so hold on, but it's really original. It is the Downtown Durham Streetery. I know, out of the box thinking, really far out there. It took us a lot to come up with that. But that is what we're calling it because that sounds a whole lot better than barricades and street closure. So that's what we're going with. We're working with somebody to come up with a branding of this. So the hope is that we can really build some momentum behind it safely. And we are now working with the city. They've been great to work with. I'm very accommodating and trying to make this work. Fire department, the police department, to make sure that we have this covered. We are looking to close either complete streets or lanes along Chapel Hill Street, Paris Street, and Main Street within the loop. This does not go past the downtown loop. We're trying that as a test pilot and to see how that works. And we are keeping the north-south streets open so that people can move through downtown, also for parking. We've heard a few folks from outside who have heard about this. What about parking? Because, you know, parking's a scary thing. But we are keeping a big part of Main Street closed. One lane closed as you get into the 100 block of Main Street up by One City Center in order to have access for emergency vehicles. Just a small part of Paris Street will be closed from Corcoran up to the entrance into the garage for One City Center. And then quite a bit of Chapel Hill Street will be closed from Market Street down to 5 Points. That's the general footprint of it. We are now also trying to find ways to make sure that we have activity happening within the footprint. So we're looking to put additional chairs out in the streets, some lighting in order to show the continuity. There are some pieces in there that we want to ensure people that you can walk all the way up Main Street by lighting the way, so to speak, with luminaries and umbrellas and things of that nature, so that there is some connection between parts of downtown that are completely closed and parts that may appear not to be closed but are. We're also looking to try to bring back some of our buskers and performers so that they will be in and around the area. Where we can, we will tie into any kind of public art that might be going up or that will be in play. And just, this is a hard place to be because our inclination is to go out and go, yay, come downtown, look at all these great things we're doing, which then means people will, yay, come downtown, and then we'll have a mass of people in downtown. One, our restaurants, because they're at 50% capacity, can't really support that. And we don't want people to come downtown and then be frustrated, like I came downtown and then I had to wait. We're trying to, when we push this out, let people know that this is over a long period. So you don't all need to come down the first weekend. You can come down anytime. Our attempt is to start this on the 18th of September and it will go through December 18th. That is a big lift. We are now out looking for volunteers to help man some of the roads and to help encourage people to walk and move about the area. We are looking at how we can make sure we have enough people downtown to help facilitate. We are also looking and working with the city on how best to drop the barriers, get them out of the way quickly. The event again will be Friday and Saturday, starting on the 18th, hopefully at 5 o'clock. Streets will close at 4:30 so that we can start putting the furniture and the things out in the street, the barriers up. We will go until 10 o'clock. So right now the plan is that restaurants need to pull everything back in from the streets at 9:30 so that the streets can be opened up at 10 o'clock. Restaurants can still serve people until their closing time and of course can serve alcohol until 11 o'clock within the confines of their either permitted space that the city has permitted for the expanding outdoor dining or inside if they're allowing people inside.
That's terrific. Really exciting. And I know a tremendous amount of work has gone into this. So thank you so much for your leadership and the entire team that has been working on this.
Thank you.
Really exciting. Excellent. I'm going to see if we can just switch things around a little bit on the agenda this morning. And we have a guest here, Michelle Lynn from Duke, who is here to talk about, she and Pilar will talk about a grant that we have received for support for those who are having to quarantine during COVID. And Pilar will talk about the expanded community health workers and then how those two intertwine. So I'm going to turn it over to Michelle and then Pilar as well.
Great. Thank you, Katie. And thank you to the entire task force for all of your work over these months. I know it's been very arduous and can't thank you enough for all that you're doing for Durham County. The COVID-19 Support Services Program is through the North Carolina Department of Health and Human Services with CARES Act funding. It's intended to support individuals who need to isolate and or quarantine but may lack support in order to do so. And support can come in the form of food, food boxes, pre-prepared meals, transportation, private transportation, either perhaps testing sites, medication delivery, as well as a one-time income benefit for either an individual and or at a family level. And in fact, all of those services I just mentioned can either be at the individual level and or a family level. The state looked across and found the counties that at the time they were putting this together were really having the most significant burden as it related to COVID-19 and populations that were indeed having difficulty isolating and quarantining for COVID as a prevention effort for COVID-19. Our region is Durham, Vance, and Granville. So the funds that we receive from North Carolina Department of Human Health and Human Services will provide these support services just in those three counties. The state also developed an eligibility criteria for individuals in terms of who can receive these additional support services. And that is folks who have tested positive for COVID, individuals who may have been exposed to someone who's tested positive for COVID, individuals who are awaiting test results, and then individuals who fall into what they're describing as a high-risk category and who really need to isolate as much as possible as a prevention strategy. So in that instance, it may be elderly individuals with multiple chronic diseases, and it's best for them to isolate as much as possible. It could be pregnant women, it could be any number of categories where a person may be at higher risk in terms of being exposed to COVID and actually testing positive for COVID. The support services that are included, as I mentioned, could be nutrition assistance, either in the format of a food box or food boxes, pre-prepared meals, the one-time income payment to help with any related expenses to the individual isolating and or quarantining, private transportation. It could also be the private transportation they may need to a medical appointment, et cetera, or anything else that they may need, but so that they're not utilizing forms of public transportation during their isolation or quarantine period. And then of course, if they need medication delivery, as well as what the state is describing as a COVID supply box. So a box that is filled with things that you may need in terms of over-the-counter medication to address symptom management, hand sanitizers, thermometers, things like that would be in the COVID supply box. The program actually works hand in hand with what Pilar is going to talk about in a few minutes. So the support services program is tightly linked to our health departments, our Durham County Department of Public Health and our Vance Granville Health Department, for obviously identifying folks who have tested positive, but also folks who may be calling into their hotlines around COVID-related issues. Referrals are made to community health workers, and Pilar is going to talk a little bit about that initiative that the state has funded. The state is funding approximately 300 community health workers across our state of North Carolina. Durham, Vance, and Granville, of course, are included within those counties, and we have a number of organizations in Durham that will be or have already brought community health workers on that will help to connect individuals to these support services. So the end of the community health workers will actually make the referral in for the support services. And our role at Duke will be to take those referrals and get them to community-based organizations in Durham who can deliver those support services. So as we know, so many of our community-based organizations across Durham have been doing this already for our community, have been providing meals, have been providing food boxes, have been providing assistance. And this through this initiative, the state will actually reimburse those community-based organizations for those services. So they have identified a price list, if you will, for each of those services, how much a food box is, how much pre-prepared meals are, and the community-based organizations will now be able to invoice for the delivery of those boxes to individuals who have been identified by the community health workers. We are literally just starting up and running today. The award notice went out on August 25th, and we had to be up and running. Actually, we were up and running on Tuesday, September 8th. We had the 2-week period to get everything up and running. And our referrals started Tuesday and Wednesday, and we started delivering services to individuals in Durham and Manson County yesterday and today. So we'll continue, obviously, with the referral process. The entire initiative will utilize NC Cares 360, the state's referral platform. So there'll be a way of ensuring that all of the community-based organizations who are involved, the community health workers who are involved, the health departments that are involved, have a way of communicating with each other and ensuring that there are care plans developed for individuals, that those needs that are listed on those care plans, whether it's the transportation, whether it's food boxes or meals, are indeed being met by the community-based organizations that we're working with to meet those needs. I know that was an awful lot, and perhaps not in an order that made as much sense as possible, but it is quite an innovative program by the part of the state to try to ensure that, as I mentioned, all of our community-based organizations that have really risen to this challenge are supported in some way as much as possible to continue to deliver these services to our community members that are most impacted by COVID. There is, of course, a time limit on the services. They are looking at a 14-day service period. So if you've tested positive, referrals made in 14 days from the time the referrals made, that you would be eligible to receive, whether it's food boxes or pre-prepared meals, et cetera. There is an option for individuals to re-up those services, if you will, and that would especially be true for our high-risk populations who certainly may need to isolate for more than 14 days as a prevention strategy for COVID. So lots of process pieces to it, but we are underway with our community-based organizations here in Durham, as well as those in Vance and Granville counties. I am sure there are questions from the group.
It's terrific. Thanks, Michelle. Pilar, did you want to add anything about the community health workers?
Thank you. Good morning, everybody. And thank you, Michelle. Yeah, so as I think I talked about this before, so from August 24th, we started with the community health workers supported by the state. So we at El Centro hired 40 community health workers. From those, 10 are in Durham, supporting the work in Durham. And now we are tying this with the support services grant that came this week. So the idea is we are getting already the referrals, and then our community health workers contact the families to see what are their needs. And we are specifically giving food, boxes of food, and also the COVID kit. But we enter the person or the family in the NC Care 360. So then others who are giving transportation or medicine or the other services can pick up that family to complete the service to those families. So that's mainly the work we are doing right now. And I think this is very exciting to support the community. We are trying to get out to the community how these services work, so people know exactly what to expect, because also there is a lot of confusion with the community health workers, the support, it's not an incentive, but the economic support the families are receiving, and to understand that this is for, it's directly COVID related, so people understand what it is. But I don't know if you have any more questions. The other 30 community health workers we hire at El Centro are covering part of Vance County also, and also Wake, Orange, Granville, and Harnett.
Great, thank you. Are there questions? I think this is really exciting and really good for the community.
I have some questions. Michelle, thank you for being here to tell us about this. I've been anxiously awaiting the news about this program, which has been so important. CC, the folks that CC works with are just really the kind of people that really can benefit from this program. I think one of the big issues has been workers not having any type of hazard pay or sick leave or anything like that. So Michelle, can you mentioned the one-time payments for individuals or families. What is that amount, and how will that work? That actual grant to the family.
Sure. So again, the individual would work with one of the community health workers to identify what the need is. For an individual, the one-time payment is $400. For a family, it's $800. The individuals for all of these services actually have to attest that they have no other means of receiving whatever kind of support it is. So whether it's the food boxes, the pre-prepared meals, and or the income benefit. Right now, what the state is classifying as no other support for the income benefit would be if an individual were being paid sick leave, or if an individual had some other form of income actually coming in. So Wendy, to your point, for folks who do indeed need to isolate and or quarantine and are not paid for that time, they would certainly qualify then for the income benefit. The community health worker would merely work with them to fill out the referral form, and then we would respond by either sending a check to the individual. If the individual, in many cases, what we've already seen is individuals have said there's a specific bill that they need paid, whether it be a utility bill or a rent payment, and we can actually make that payment directly. So that even cuts down the amount of time that it would take, for the individual. We can cut the check very quickly too, but it sometimes can alleviate the extra step for the individual of getting a particular bill paid. So either way, we can work with them.
That is great to hear that you all can actually do the direct payment of a bill like that, because that was going to be one of my concerns, was just the process and how long it would take for the money. So, and that, if you're recovering or if you're not well, I mean, that can be very stressful to think about like that hanging over your head. So that is fantastic. The other thing is, like a lot of other things with COVID, it seems like the crisis is accelerating us doing things. And so it'll be interesting to see how the NC Cares 360 works. I would love to hear, as this rolls out, making sure that all of the community partners actually get enrolled into that platform, and getting everybody to use that. It's a new thing, and maybe like telemedicine, it will really accelerate the functionality of it. I hope that's the case. But I'm so thrilled that Duke got this grant, and this is really, really important for a lot of people in our community. So thank you. Oh, and I guess one more question is just referrals, like for instance, folks that, I'm thinking that like CC works with, how is it, like, is there a certain phone number, or how would you get the process going? What is the kind of point of contact that like we could share if we know about somebody who needs help?
So as Pilar mentioned, we have a number of organizations in Durham, including El Centro, that have community health workers now on staff that will handle these referrals. So for Durham County, it's El Centro Hispano, La Semilia, Project Access of Durham County, TRI, Communities in Partnership, CARE, and PEACH. All have community health workers on staff. And I know that's a lot of different organizations. Certainly, and I put Rod on the seat. If folks are calling the health department also has the list of organizations that have community health workers that can work directly with a person. And the really the beauty of having the community health worker involved is it's not just about getting the particular food box delivered or the medication delivered. That community health worker really becomes a trusted source to that individual and or family throughout their entire experience. So beyond these support services, the community health worker will likely be working with them on other issues that they may be facing as it relates to COVID. So.
Fantastic, thank you.
Yeah. I would like to add something because this is something we have talked in our meetings, and is at least for the Latinx community, we ask them when we talk to them if they feel comfortable for us including their information in NC Care 360. Because we know it's a lot of fear about it, but if they say yes, we include them in the system. If not, they are still in our protected database at El Centro, but then we continue with the services. No matter if they are not, we will find the other services for them.
Great, thank you. Any other questions?
Question. Yeah, thank you, Katie. Michelle, we're so lucky to have you. You have been such an incredible leader through this whole COVID time and serving our vulnerable populations. So that's the first thing I wanted to say. Thank you so much. Could you make that list of organizations available to us?
Yes.
If you could, I'm sure if you got it to Amber or Ryan or one of our folks that we could, I think we'd all like to have that so we could help refer people.
Yes.
So is there, I don't know how this relates to, so if someone is being contact traced, and this is probably a question for Rod as much as for you, but is that also a way of, does that have to be kind of privileged, and or is that also a way that people can be, I mean, privileged from a privacy standpoint, or is that also a way that people can be fed into this system?
I don't know if Rod wanted to answer. We're both shaking our heads yes. So, because this initiative is tightly connected to our health departments. And in fact, even in putting the application together, we work closely with Rod and Lisa Harrison, who's up at Vance Granville, and putting the application and the process together. So I'll let Rod.
I would concur. As a part of this being a pandemic emergency relief, we've been instructed by North Carolina Department of Health and Human Services that it's all interconnected. In fact, I do have a 8:30 meeting on Monday with Maggie Sauer, who's over the Office of Rural Health, and we'll kind of put the finishing touches on this great benefit for our communities.
And does it also go the other way potentially? That is to say, if somebody identifies themselves to one of these organizations, Michelle, as being COVID positive, I see everybody's nodding your head yes. So then they're referred to the health department to be for the contact tracing.
Yes, sir.
Okay, great. Thank you. Very exciting.
Terrific. Thank you. Michelle, thanks so much for joining us this morning. Appreciate it, and appreciate all that you've done, as the mayor said. All right, let's turn to Rod for our update on our metrics. And I am just going to share, I need to step off shortly before 9, so I'll turn over to Maticia at that point. I have to step onto another board meeting. So Rod, well, as we get started, why don't I quickly give the update. So we are at, for our 7-day average, and I apologize, I'm not as prepared as I usually am on this, but the 7-day average for hospitalizations between Duke University Hospital, Duke Regional Hospital was 30.5. It had been at 35 the last time we met. So again, seeing improvements in that, and we're still at about 90%, 90+% occupancy. Varies by day. Again, don't expect that to change because of the fact that Duke University Hospital in particular is a tertiary quaternary referral center. All right.
And I'll go ahead. Good morning to everyone, and I'll be extremely brief because a lot of the materials you've already received, and I too have to step off around 9-ish for some mandatory training, I should say, with the state for health directors. As of yesterday, we stood at 41 cases. Our active cases are 240. We have 6,907 individuals who've been discharged for care. We did pick up a few deaths, so we're sitting at 86 deaths. So that total since the pandemic began is 7,235. 13,722 contacts have been made between Durham County and CCNC. As the chair alluded to, our 7-day moving average is 28, and that's a decrease from 38 last week and 32 the previous week. So we continue to move in the right direction. As far as race, ethnicity, and work, not much change. However, we still see the rates continue to go down in the Latinx population as far as COVID positive rates. They're at 40%, Black African Americans at 35.24, and white Durhamites are at 21.9%. In terms of work, race, ethnicity, and sex, we're not seeing as many restaurant workers as we did before, so that's a good plus, but we still see unemployed, people who work in universities, and then people who work in hospitals, particularly around general medicine and surgical. A little breakdown for that, 40.9% were unemployed of the Hispanic population, and the majority were female. 80% were construction work, Hispanic, majority all male, and 30% of our cases were associated with nursing care facilities, Black or African American, 30% were females. So we continue to go through our work with that. As far as our positive percentage rate, as indicated, per NCDHHS, they had us listed at about 4.2%. But again, as of Duke's model said that North Carolina's infections had grown to 5.3%. However, Durham's infection had grown to 2.6. So again, still indicative of the work that still needs to be done, but we're excited about that. And we are continuing to stay vigilant and be very cautious as we approach the next couple of weeks with the true beginning of the fall. Before I turn it over to Dr. Akinboyo, I'd like to share a little bit more good news. The zip code 27704 has kind of plagued us. That's really been the zip code where we've seen the most cases. And I thought it not robbery to let the retail pharmacies know that those are the areas that we really need some additional support. So I'm proud to announce that CVS will now be located not necessarily in 27704, but right next door at 27703. And that'll be on 5111 Wake Forest Road. They will open an additional site, which will make 7 sites for testing in Durham County. And then Walgreens, for the longest time, had been on Guest Road, and they had jumped and basically left Guest Road effective September 1st. And they have now moved to 200 North LaSalle Street. And that's also in zip code 27703. So we continue to see some success with our retail partners. Of course, Lincoln has continued to never stop testing in earnest, and there's no hindrance in testing in Durham County. With that, I'll turn it over to Ibukun.
Thanks, Rod. Good morning, everyone. Just 2 comments on the data trends over the last 2 weeks. I think we're sort of holding our breath to see what the holiday weekend will do to our rates. It just tends to have a slight increase after every holiday weekend, but hopefully we're all in this together, and I think our habits will play out and ensure we don't see that bump. We're hopeful. I think one other small point we had discussed previously about the breakdown in the number of positives according to racial and ethnicity groups, and we're starting to see that the Black African-American group that are positive, that proportion is starting to rise higher than the proportion of residents in Durham that identify as Black or African-American. So again, what does that mean practically speaking? Since the numbers are going down, which is a good thing, we always worry if you look at the population of Durham, if the numbers are not reflective of the breakdown of our population. And so as we're talking about resources and education, just important to note that slight trend. I hope it's a temporary trend and we see overall cases go down as a whole across all groups. But as we're heading into the fall months, quick PSA and plug, influenza will come, it comes every year. And the symptoms are very similar to what we're finding in COVID. And we don't want to, again, overwhelm our hospitals and all of the things we've discussed so far. So it's important to get your flu vaccine, but we need to continue all of the efforts we're doing with COVID-19 to ensure that our groups and our communities are not disproportionately affected again. Happy to address any questions. Thank you.
I have a quick question for either of you. This is about the growing concern of mental health challenges and issues among adults and children over the past 6 months. Is there any, what's happening in Durham to expand or provide mental health services for adults and children, or just any information in general that can be shared about that?
I can speak somewhat, and I will say I may have to reach out for help with where we can have free resources. I know that we started to see, unfortunately, an upswing in anxiety, depression, and suicide. And we don't, this is not about numbers anymore. Just even one additional person going through mental health issues without help is enough concern. So I appreciate you for bringing up that question. I think for now, people have increased access to virtual support services, and there may be others on this call that can speak to free access to services as well. And this goes across both children and adults. I can speak for Duke, but I don't think that necessarily would apply across all of Durham, so I don't want to necessarily overemphasize that. I'll defer to you, Mr. Jenkins.
Thank you for your question, Ms. Lois. I will say that as a member of our vulnerable populations work group, and OSHO has been instrumental in continuing to beat the drum for mental health awareness during COVID. And to Maticia and Katie, I would just ask that maybe we just invite her to shed a little bit more light on mental health and its impact on Durhamites during the COVID. But she has been really letting us know what services are available to the greater Durham community. And I think that it would be a good thing to have her just give us an update.
I agree. Happy to invite her to one of our upcoming meetings. And she has been a terrific partner on this. And she has described this, and I think, and I've now used this, I've borrowed it from her several times, that she's really described it as a three-phase crisis: the public health crisis, the economic crisis, and then the behavioral health or mental health crisis. So I think your question is very timely and spot on, and we do need to talk more about that and what resources are available. So we can invite her to an upcoming meeting.
Thank you.
Thank you.
I had just, I wondered if we could also hear from Phil about how things are going at Lincoln and what he's seeing there.
Thank you, Mr. Mayor. At Lincoln, we've seen a dramatic fall off in demand for testing around COVID. Don't know if last week the holiday played into that, but our numbers were the lowest they've been for some time now. So what we've done is we've placed signs out front on Fayetteville Street. That Fayetteville corridor is a very busy corridor, advertising that there's free testing for COVID, and also advertising that there are free flu shots. So we, earlier this week, we had a request for flu shots. We had 16 calls come in. We set up appointments for those individuals, and 15 of them showed up on Tuesday. So we've started the process of our free flu shots. In terms of demand for other services, demand for regular primary and preventive healthcare services is, I mean, unprecedented, it would seem. In the mornings, there are lines out front of individuals trying to get in for primary care services. We try to keep a balance of appointment services and walk-in services so that we can continue to serve the community. And should also remind the task force that we provide behavioral health services also and oral health services. So the demand for oral health, behavioral health, and general primary medical services are up and remain up.
Thank you, Phil. I really appreciate hearing that.
And just can I, and on the topic of flu vaccines, and I'm really glad that Lois mentioned mental health. I wonder if we could also, at an upcoming meeting, just discuss what resources that we have for flu vaccines. So between Duke, Department of Public Health, Lincoln, what are the resources that we have, and how can people get access to them? And then how can we get that information out to the community? I think would be good to talk about that.
Chair Jacobs, we have discussed having that on the agenda for our next meeting. And so we will definitely add that to the meeting on the 25th.
And Ryan has prompted me to suggest that we all get our flu shot by the next time that we get together, and that we put it out on our social media so that we can be promoting it to our community. So I'm going to get one.
All right. So that's great. So I'll be taking a roll call at the top of our next meeting to see who has gotten their flu shot. And I think I have a doctor's appointment coming up, so I should be good. So I'm going to transition us to our next topic, which is an update from Cover Durham. And we've invited Isaac, I hope I don't butcher your last name, Henryon, to provide us an update on just plans for procuring and distributing the remaining face coverings made possible by the contributions from the city, county, and Duke. And update us on some findings from the Latinx mask user experience report. So I will turn it over to Isaac. Isaac, you're on mute.
There we go. Can you hear me?
Yes.
Sorry, I was having some technical difficulties. Thanks very much for having me on this call. I really appreciate the opportunity to present some of the work that we've been doing, not just to update on what we've on our next stage of the project, but also just to give some context over the whole project. So just to remind people, the Cover Durham kind of started with, at the start of April, really. There was a group of doctors and organizers who decided that on the balance of evidence, universal masking was really crucial because we could see countries where mask mandates were present and they saw lower patterns of transmission. And the problem was that it was really difficult to acquire face coverings, and there was no culture of wearing them in Durham or, I mean, North America, frankly. So we fundraised to pay local sewists to manufacture masks and then distributed them around the Triangle and actually as far as Eastern North Carolina. One of the great things that happened very early in April was that the county and the city, DPS and Duke recognized the urgency of the situation and actually awarded funds to scale our project and create this thing called Cover Durham. So its purpose was to achieve universal masking in Durham by distributing as many reusable face coverings as possible, especially to communities who are at high risk of getting and spreading COVID-19. And secondly, to encourage their use through communication and advocacy. By April, the case data clearly showed that Black and Latinx people in Durham were unjustly and disproportionately at risk for several reasons, such as pre-existing health conditions, lack of access to healthcare, and more likely to work in hazardous public-facing jobs. So responding to that data, we worked to prioritize communities of color in our distribution. which had kind of two stages. So the first stage, we procured and distributed 44,500 face coverings that we procured from the original mattress factory. And that was using funds from the city, county, and DPS, working with over 40 community organizations, including Community Health Coalition, El Centro Hispano, and Bike Durham, to really prioritize communities of color, also transit riders. Bike Durham did an amazing job distributing masks at the bus station, which is amazing because people were worried about riding the bus, and it was really important to make public transit as safe as possible for people who really depend on that to do their job. So alongside those face coverings, we also included flyers that were encouraging their use and why you would use them and how you would use them in English and Spanish. So that was the kind of the first phase of our project, and that wrapped up in June. It's just at the start of July, and we moved to the second stage. At that time, we recognized that it wasn't just communities of color that were at risk, but specifically Latinx communities were facing really, really stark levels of COVID. And so we opted to do a distribution specifically to those communities, and specifically developing culturally resonant messages for that community on the basis of those case levels. And before we got started, we actually did a user study of 22 Latinx workers in Durham. So these were construction workers, plumbers, restaurant workers. They did landscaping, cleaning, and other janitorial. And the goal was to understand what kind of mask was actually useful for someone who was having to wear it 8 or 9 hours a day. Many of people who just need to wear a mask when they go to the grocery store wouldn't necessarily have the same needs as someone who has it on for 8 hours a day in the Durham heat in the summer. And so we recruited these participants for a paid user study and had, I think, 21 different models of mask. And our goal was to understand the important characteristics of a durable, comfortable, reusable work mask. So for 4 days, each participant wore a different mask and then gave their opinions to a volunteer interviewer every day. And at the end, we also conducted a kind of in-depth user interview with each participant to figure out their attitudes to masking more generally, what held them back from wearing masks, what did they think held others back from wearing masks, and to give their recommendations about which mask to buy. So this was, I think, a really great success, and we learned a lot. Certainly compared to our first distribution, we had a lot more information, and the highlights of the study were that people wanted a dark colored mask because people who have, who maybe work dirty jobs, they didn't want a white mask that was gonna get dirty really quickly. Obviously 2 layers of tightly woven cotton. I mean, that goes without saying. A filter pocket for an optional filter was what people wanted, because some people actually had a lot of difficulty breathing through the PM 2.5 filters. Not everyone, but some people did. So we wanted to give people the option. And then also adjustable nose pieces and adjustable ear loops in particular, because not everyone's face was the same size. And we were finding that some people, the masks were too big or too small. And if you have that adjustable ear loop, then you can do a mass distribution much more effectively. So on the basis of that study, we procured 30,000 masks, 20,000 for adults through an international supplier based in South Carolina, and then 10,000 for kids made by the Scrap Exchange. Thank you. I'd like to say thank you to Katie for suggesting the kids masks, because we're now taking kind of a whole family approach. At the beginning, we were just focusing on adults because kids were, mainly at home, but as kids have more and more activity around, it's really important to get masks for kids. And that was a big thing that we heard from the user study, was that families said that they couldn't get masks for kids. Where do we buy a mask for a kid? We have no idea. So alongside those masks, we made a new flyer. We worked with Pilar and designers and behavioral scientists to kind of design a flyer that was going to deliver really important messages about masking in Spanish. A lot of it was based on a UNC study on face covering attitudes, which messages were resonant with that community. And what it says basically is, it emphasizes the importance of bringing a mask with you as part of your daily routine. So our slogan is keys, phone, mask. And that was a kind of message that we want to increasingly instill as we recognize that masks are a part of our daily lives. We have to, personally, my most common reason for not having a mask is I've forgotten to bring it with me when I left the house. And so many people say that. And so really instilling that idea of a daily routine is something that we're trying to do. We're also reminding people that they live in a bubble, which is their household. And the household is not the same as your family necessarily. For some people it is, but many people's families are spread across different households. And so if you say protect your family, then it might not be the same thing as protect your bubble. So we're trying to emphasize the difference between just who you live with and then your social sphere. So today I can actually say that we're packing up all of these masks and flyers into bags, and then tomorrow El Centro, La Semilla, Iglesia Presbiteriana Emmanuel, and Siembra are going to begin to distribute these masks to Latinx communities in Durham through food distributions, events at trailer parks, and also going to local businesses. And after that distribution, the project is actually going to be at end. In total, we'll have procured and distributed around 75,000 face coverings, which I think is, I'm pretty proud of anyway. And I think a lot of people, have benefited from it. We've learned a lot, I'd say, as the project's progressed. So initially we were focusing on quantity and speed, and now we are more thinking about communication as a part of our work, because it's not just wearing a mask, it's, why do we wear a mask? When do we wear it? How, what kind of mask is best? And all these questions are really crucial, and the answers are probably going to change as time goes on. So we have to keep monitoring it, we benefited a lot from input from the city and the county. So from staff and also organizational support. I'd say one thing in future projects, it would really, I think, improve accountability and transparency if that input from local government were formalized and there were kind of a clearer governance structure that was set up from the beginning. That way you could kind of build the expertise and connections in from the very start, into the very fabric of the project. In kind of closing up on the project, I'd say that the conditions have changed. Masks aren't an alien concept anymore. You can buy them in a lot of stores now, like a toothbrush or something a bit more expensive. And so beyond distribution, the challenge is going to be, how do we maintain a culture of mask wearing for the foreseeable future? How do we actually get people to wear them and to wear them correctly? And as part of that, we have developed a group of people across the city and county and Duke and other organizations to consider different issues regarding face coverings. So, for example, we've worked with Pierre Owusu-Osei in transportation to make sure that Durham's buses have disposable surgical masks, which I think is a really cool development. And we're going to keep addressing new topics as they come up. So right now we're thinking about evaluation. How do we know how we're doing when it comes to how many people are wearing face coverings and how are they wearing them? And what are the barriers? And if we can answer those questions, we can make sure that new interventions actually, really contribute to our city's health. So that's kind of my update. I'd just like to say a few thanks to so many people that have supported our project. Obviously the city and the county, Community Health Coalition and El Centro and Scrap Exchange have done so much work to support us. Ryan specifically has given us a lot of organizational support, as well as connecting us to translation resources in particular, which I really appreciate. The task force's commitment to language justice as a part of the recovery, I think it's really big. And I'd also just like to thank you all for recognizing, I don't know how important face coverings were at the very beginning. And Durham passed a mask requirement on April 17th, which was ahead of so many places in our state and country and other places around the world. And so I'm just thankful that we have leaders who listen to scientific evidence, which is very cool.
Thank you for that great update, and thank you for sharing the additional context as well as an update on the project itself. Are there any questions for Isaac?
Maticia, I have just a comment, which is that Isaac, in addition to the fabulous work that you all have done, actually creating this supply of masks and getting them out in concert with your community partners, I think the other thing that you have done is really help create this culture of masking in Durham. That your advocacy, I can tell you right now, you've talked about the fact that we made the decision early to require masks in Durham. And I think that, I think we're all proud of that. That would never have happened without the folks in Cover Durham. Before it was Cover Durham, honestly, pestering, hassling, and cajoling us. I know Wendy will agree. Hearing constantly about the need to have a mask requirement in our order, and that advocacy, I think, has really been as important as the work supplying your work supplying the masks. It's created this culture, and I was thinking about what you said about where we are now with our transit. We were giving out. I think this may have been reported at the task force before, but I'm not sure. Sometimes I can't remember where these things get reported, but we were giving out prior to having the mask dispensers on the buses, 500 masks a day on our transit, and we're now giving out 1,000 masks a day on Durham Transit. We've already got another order in for, I believe, 40,000 more masks. Ryan, I believe, is that correct?
That's right. And then just as one correction, it was 500 a week to 1,000 a day.
I'm sorry, 500 a week
yes, sir.
to 1,000 a day. Yes, thank you. And now we've got another order in for another 40,000 masks. So all of these things are very much due, Isaac, to the work that you all have led. And I just want to express my extreme gratitude.
Thank you.
And I want to add my comments to Mayor Schul. Really, it was Isaac and two doctors, Dr. Larry Greenblatt and Dr. Eric, what is Eric's last name? That started us out of like the trunk of their car, literally, back in April, who were just really passionate, working on the weekends at night, who really started all of this. So thank you to all of you. And Isaac, you have really been a leader on this effort. You have been so committed to this and so willing to then transition and partner with community organizations, working with the Community Health Coalition and El Centro and Bike Durham, just the way that you've pivoted to working in partnership with the community has also been amazing. I'm sorry to hear you say I'm sorry to hear you say it's ending, but well, I guess it's a good thing maybe that it, maybe that's a sign that it's, things have to transition. But I think this is one of the most important tools that we have. We don't have a lot of tools to fight this virus. And we know now that wearing face coverings, wearing masks is one of the most effective things that we have. So we have to stay committed to it. We have to stay focused on it. Like what you said, Isaac, the information you shared was so important about really digging deeper into how to make it effective in terms of the communication and making it work for people and their lives and their families. So I guess I still feel like we're going to need a mask czar or a champion. And I guess I'm a little worried about you going away because, and I know Marielle is on here from the Duke Center for Advanced Hindsight, but this whole issue of how do we sustain the culture and, even moving into 2.5 and not feeling like we're being lax about it and that we need to we can't let down our guard. I just didn't, I think this is something the task force is going to need to stay talking about and focused on. I can already see that it is, the people are kind of relaxing a little bit and we can't. So I would love to hear some of your thoughts about that.
Chair Jacobs, let me just add one thing before Isaac shares. This is, I think, to ease your concerns a little bit. So Isaac has agreed as Cover Durham is wrapping up. So the group that he mentioned is directly connected to the task force. So we have stood up a kind of small team that's meeting regularly to help the task force stay focused on face mask. And Isaac is volunteering to help co-lead that. And so we're not going to lose the expertise that Isaac has developed over these last 6 months or 5 months of working with Cover Durham. He and others are going to continue to volunteer to focus on that, to help us think through it as a task force, to assess where the needs are. And so I just wanted to thank Isaac for continuing to volunteer in that capacity.
Yeah, like as Ryan said, yeah, this group is the Cover Durham, distribution aspect of doing a mass distribution is coming to an end, as I think it should, in the sense that future big distributions, probably can be handled by existing, institutional frameworks. And based on what we were a kind of startup organization that, came in very rapidly to do some work, but now a lot of that knowledge has been kind of gained. And if we can maintain it, then and feed it in, through our local government institutions and stuff like that, then I think the work can be even more effective. And yeah, I'm gonna still be around, don't worry.
Great.
Thank you so much, Isaac, for your great leadership. And I tell you, it feels really good to live in a community where face coverings have been emphasized from the start. And, I would say for me, I've been fortunate enough that I had a birthday a couple of months ago and my kids got me some cloth face coverings. And so now my big decision every day is which one of these face coverings match my outfit, because I really feel like face covering has become a part of my outfit on a daily basis. And I certainly don't leave home without one of those. So again, thank you so much for your leadership and looking forward to continuing to work with you, Isaac.
Thanks very much.
I just want to say gracias, Isaac, because you've been very inclusive, really bringing everybody together, but also very thoughtful. And I think that's very important because you've been really creating community. So gracias.
De nada.
All righty, so thank you so much. I'm gonna move us on to our next topic, which is Susan. Susan's gonna give us an update on the Back on the Bull campaign. And I'm delighted when I go out and actually see signage of establishments that are participating in Back on the Bull. So Susan?
Very good, thank you. Can you all see my screen?
Mm-hmm.
Okay,
yes.
Good. I appreciate all the support that has gone into the Back on the Bull campaign from the Center for Advanced Hindsight, McKinney, and the support from the task force who has funded this campaign. And so in the interest of making sure that we are providing feedback on where the cities and counties dollars are going, I wanted to provide a quick update on where we are so far. So let me go through and do that. Just as a reminder on what the campaign goals were, we wanted to reach Durham and Triangle residents with the message with a real focus on driving people to the website, which is where we have the heart of the information. Our goal based on the amount of funding was to hit at least 9.6 million ad impressions. And the length of the campaign was from the paid campaign was from the middle of August through the end of the calendar year. So we will continue to do this and we're really just getting started with that. We did start the organic campaign, meaning use of email and social media through a lot of different channels without paying for it, the more free options, back in July when the website first launched. An important part of the campaign, one of the guiding principles is the commitment to equity, and everything that we're doing is in both English and Spanish. And that is not only in the creative, the messaging and graphics that go out, but also in our selection of media outlets. And you'll see a little bit more about that. This gives you just a quick visual on the campaign and how it's running and the channels that it runs across. You can see print, social media, digital, bus advertising, billboards. We've covered a very wide range. The darker colors are where we have the most intense coverage, and the lighter colors are where it's a little bit lighter in terms of the number of impressions. We have a spreadsheet with mind-numbing detail on all of this, but this is the sort of very high level on what you can see and expect. Here's some examples of the advertising creative, and you can see in English and Spanish You can see over on the top right, these are some of the digital ads that are going out. And on the bottom right is a photo of one of the billboards out on the highway. This is a look at ad impressions. So as I said, our goal is 9.6 million ad impressions over the course of the campaign. The green bars are a weekly basis, and the way those work out, I wouldn't look too closely at those. It'll show, if we've got a 2-week flight, it'll show all the ad impressions being in the first week. So not quite as accurate as the more detailed chart might show. So we are certainly, given that we are really just getting started and we're at 6 million ad impressions, we are well on our way to exceed what the goals have been. This gives you an idea about web visitors. Again, the green bars are how many per week, and the purple line is the cumulative. And we've circled a couple of points on this chart to show you where the digital campaign and radio started toward the end of July, and then in the middle of August, with funding, we were able to start some of the paid social and TV. So what we saw, and this is really what we would expect in the very beginning, the first few weeks of July, this is where we were reaching out to the roundtables, reaching out through our channels where the businesses and things that were really intently focused on being part of this got started. So you see a strong upward climb. There's a period in here for about a couple of weeks where it flattened out between the end of July, and that was before we were able to start the paid media campaign, and then you see it starting to grow again. I'll also say that I expect to see the line go up a little more steeply when you get into September. Late August is always a slow time in media land. People are on vacation and getting ready to go back to school, but we would expect that this will continue to grow. This is page views for the website, and some similar things, and I'll have a little more detail in a minute about what pages people are visiting, but same sort of pattern where you see in the very beginning we had lots of people going in and completing the checklist, and then it flattened out a little bit, and then as our media has started kicking in, you see the trend going up again. And this is, I think this is important to look at. These are which pages on the website people are visiting, and you see, of course, all of our advertising is pointing people to the homepage, and so you would expect that is the place people most often land. And then you see the next most popular page is the checklist, which is exactly what we wanted to happen the first few weeks as the website was out there. The who's taking part is where someone coming to the website to see which businesses have participated would go. And that's a little bit lower right now, which is okay. That's the number we really want to see grow, because now that we certainly still want people to be completing the checklist, but we really want to point our residents to the database to see which businesses are participating so that they will visit them. This gives you a little bit more information on the organic timeline and I've spoken to this a bit about how it rolled out. Early July, we did the soft launch of the website and reached out to businesses through individual channels. And then mid-July, we did more around social media posts and email and working with Durham partners. You're going to see some examples of that in a minute. And then we've done a lot of pitching for media and have gotten a number of different interviews and stories out there in the press. And then we are actually done the first phase of the ad campaign and are going to be moving into the second phase shortly. These are some examples when we say organic outreach. You see the Durham Chamber's use of the information, the city and the county and how they posted it. El Centro has pushed out information about it, and Discover Durham, just to give you a few of the examples. And this is really important, and I want to continue to encourage everyone on the task force, if you have channels available to communicate with the public, please use them. And if there's more material that you need, let us know, and we will help make that available. We are moving into working as much as we can to collect photo and video of people using social distancing and practicing the right behaviors out in public. If you go out to eat and you're wearing a mask, take a picture, send it to us. And if you need some assets that you can use in your channels, please let us know. And then the last thing I wanted to talk about, just to give you an idea so you know what's coming out, is the Rediscover Durham campaign, which we've talked about. This is Discover Durham's program to encourage people to be out and frequenting our small businesses. And this is getting underway. We wanted to wait until we'd gotten at least we were hoping for phase 3 at 2.5. We feel like we can start some of this messaging, but this is a year-long campaign that we're planning. And one of a wonderful surprise for us over the last couple of weeks is that Visit NC, which is the statewide travel and tourism organization, has made some funding that they've received through the CARES Act available for co-op, which means we have been able to more than double our budget for this campaign. So just to give you an idea, here's the logo for the campaign and some examples of some of the media. This will go out. We've already got some of this out in print media. We'll also go out in our social channels, online display advertising, digital billboards, Spotify, a number of channels. And this is the Rediscover Durham concept, is something that we would love to have other community partners adopt and adapt for their channels and purposes. And if that's something that's of interest to others, we'd be happy to help out with that and have some discussion about it. And that's it. So let me know if you have some questions.
Thanks for sharing this, Susan. This is great. Just to really see what's been done with the money that's been received from the city and the county. And it makes me, as you were going through the information, lots of great information included, it made me think about, maybe it's a question for Mayor Schewel and Chair Jacobs, because I think as we've gone before the city and the county and requested funding, and they've graciously provided funding for this budget proposal and others, how do we communicate back to the county and the city that we are definitely using the money that they allowed us to have to support the efforts and the impact that the money is having? And maybe that's just something for us to think about, but I think it's important for us to have a communication loop back to keep them aware of what's being done with the money that's been provided to support these budget proposals.
Very good. Yes, we have lots more information and data we can share, but we just don't want to overwhelm people with more than they want to see. One of the other things I forgot to mention along the way as we think about what channels we've gone out with, and people have asked about this. There are 24 different media outlets that are a part of this campaign. 13 of them specifically target Hispanic or Black audiences in the Triangle, and the others include things like the TV stations, which of course have a broad reach to a lot of people. But we've been very intentional about how we have planned out the campaign to make sure that we're trying to reach all of the audiences and really put weight on the audiences that have been the most impacted. All right, I will stop sharing. And thank you for that time.
Thank you, Susan. Any questions or comments for Susan before we pivot to our next topic?
I have one question, Susan, which is, do you know how many businesses are now, do you know how many businesses are now, have gone through the checklist and signed up?
The last I had heard, it was a little bit more, and maybe Marielle maybe have some more recent information. Last I'd heard, I think a few days ago, was that more than 300 businesses had completed the checklist. Not every business that's completed it is on the website for various reasons we've discussed earlier. But that's my understanding right now.
Susan, that's about right. We have, if you go online, you see, I think 215 right now. We have been, actually this week, we started following up with businesses who completed it, but chose not to make it public. And so we're working on troubleshooting that and making sure these businesses are aware that they'll miss out on the promotional opportunities with the campaign. So we'll see how effective that email back is. And then I'm really curious to see what happens as we begin to have our health ambassadors out there. One of the goals of our health ambassadors will be to raise visibility of this, but actually to also be able to, on site to work with managers at going through the tool while they're visiting a business. And I think that will make a big difference as well.
Yeah, I would like to add to that. So today we are starting a pilot with some of the businesses and the checklist to see how it works.
Great.
And I just want to thank you, Susan, and everyone who is working on this. Great job on pushing out the advertising campaign, and also the Discover Durham campaign looks fantastic. So thank you for all of your hard work. Great to hear that we've gone up to 300. I was wondering if all of the posters, the free posters, have those been distributed, or are we holding out for the community health workers, the community health ambassadors to distribute those?
We're holding half of them to give for the community health ambassadors, and half of them went out. And we'll be able to print more. It's a very cost effective to print out those signs.
Right. I think those are great. The posters are just gorgeous, and I think those would be a nice thing for the health ambassadors to have, to give, tangibly, to give to people. And I'm wondering what the follow-up has been with the Pandemic Response Network folks, and whether the community health ambassadors are going to be bringing that tool and helping to push that out as an additional resource to businesses for their frontline workers.
So Chair Jacobs, that connection has been made. And I've also met separately with Pandemic PRN. I just always think of them by their letters. So that work is being done. We can provide an update at our next meeting. One last thing, I'd like to just give a quick shout out to Margaret Pentrack, who works with Susan, who has behind the scenes been doing so much of this work. She is just an incredible resource. I appreciate Susan and lending her talented staff to support us, but Margaret especially. Many other people behind the scenes are working hard, but I think Margaret deserves a special note of appreciation from this task force for the great work that she's doing. So Margaret, if you're out there, thank you.
She is, she's listening. I appreciate that, Ryan. Yes, to be truthful, I have done none of this. It's been Margaret. She's making this run.
One more observation, just so we've got, we're doing an amazing job, and Susan, thank you, and Margaret and all for getting the publicity out. I do think that it's going to be crucial to get the number of businesses up if this is going to have the impact that we want. And I agree with Ryan, it's going to be, it's really going to be helpful to have the community health ambassadors who are bringing the businesses in and are educating them. And I think what Pilar said about testing that is fantastic. I wonder also, though, if there's not, before that's fully revved up, I mean, we've got all these public relations and public information resources going out around this to the public. Is there more business to business communication that we need, or Discover Durham and Chamber, communication to businesses that we need? I know you guys are pushing it out, and I saw what you just put up, Susan, about the organic materials. I'm just wondering if you or Geoff have any thoughts about how in the, before we're fully revved up with the health ambassadors, to try to continue to push this out to our businesses because it's a huge benefit to them to be part of this publicity campaign. But if you're not part of the publicity campaign, you're not going to realize the benefit. So do you have any thoughts about that?
I agree. I think that we need to not lose sight of the fact that we're not done with that first phase of getting businesses involved. And it's true that we need to continue to
Yeah, I agree. We got to continue to kind of push out the word on this and it's not just businesses. I think it's all establishments that we continue to sort of spread the word in that regard. And we will continue to do that on behalf of the chamber.
Thank you all. I think that there is a slight mismatch at this point between the what I think a very large and very successful public information campaign and not enough businesses that are going to be able to actually benefit from it at this point. So I think that seems to me something we need to be emphasizing.
Okay.
Yeah, and yeah, I will talk to the team and see how we can tie all of this, not only looking from the public health side, but also why will they benefit from this. So we will tie it in what we are doing.
I will say that when we have regional meetings with other partners throughout the Research Triangle region, and we point to that or link to that, it is absolutely universally recognized among those partners. It's like, wow, this is a tremendous campaign, and they use it as a guidepost. So it's being very well received. But you're right, we need to continue to push it out to all of our establishments.
So Susan, thank you so much for your continued great leadership on this, and many thanks to Margaret for her support. So I'm going to move us on to budget process, and we had a meeting last week because we've had some conversations around, what's going to be our next round of submitting budget proposals. And so we met with Mayor Schewel, Chair Jacobs, Katie and I and Ryan met last week. And in that meeting, as we looked at the timeline to get information before the city, before the county, it became obvious to us that in order for us to move a budget proposal forward, we need to have that proposal ready about 4 to 6 weeks in advance to actually get on the agenda. So Ryan shared an email, and from that email you saw that for a vote on budgets for early or mid-October, we really need to position ourselves to have something to move forward by September the 22nd. And when I say move forward, it has to be vetted by the task force, and the task force making a recommendation to move it forward and ready to be presented to the city or the county. So that's why the request went out last week, a request to vet proposals today. I know it was a little sudden to receive that notice, but again, as we really looked at the process and understood how the process worked, we realized that if we wanted to get something voted on in mid-October, we needed to be ready to start moving it ahead. So today we wanted to spend a little bit of time talking about those proposals that we feel like are ready to be moved forward. And what we'll do today is we'll talk through those proposals. We will do what we did the last time. We'll have a subcommittee that we will pull together early next week, probably Monday, and I'll ask folks on the task force to participate in this task force. But on Monday, just kind of going through our scoring exercise to score the proposals and send out a recommendation to the task force, since we won't meet next Friday, to really collaborate on what we actually want to move forward. So I know that we had, I think maybe, Brian, I think we had 3 immigrant and refugee roundtable budget proposals that were brought forward. And we have Councilwoman Caballero that's joined us this morning to actually talk through, I think, those 3 budget proposals. So welcome, Councilwoman Caballero.
Good morning. Good morning, everyone. Hope everyone's doing well. Good to see you all. I just wanted to take a moment just to provide a little bit of background. I don't know what has been shared here, so if it's redundant, I apologize, of what the task force has been up to, some of the community stakeholders who've been involved, and then let you all hear our budget proposals so you can hear how the folks who've been involved in the process have informed the budget asks that we have come up with. So soon after the task force was formed, different roundtables were being created, and I, along with Pilar, started forming the Immigrant and Refugee Task Force. I want to thank Ryan because he's been instrumental in helping us get the work going. One of the first decisions that we did, which was really, really important, was to hire Tilde as language support and also as a thought partner around communication. And I think they've been used a lot within a lot of the task force work and roundtables and have been just really important partner in all of this. Some of the, El Centro is also, Pilar is there with El Centro, Church World Services involved, World Relief is also involved, Legal Aid, a variety of community members, County Commissioner-elect Nida alum and school board member Alexandra Valladares are also part of the roundtable. And it's up to about 50 members who kind of, depending on the week, there's probably a core of 10 to 15 of us who meet. We were meeting weekly and have moved to a every other week schedule like you all. And then a few weeks ago, the first big thing we did was have a trilingual virtual town hall where we invited almost all of our local elected officials, including our delegation to the General Assembly, and had essentially a Q&A with a few immigrant refugee members in our community, and also kind of informational sessions with a variety of community partners, including Durham Public Schools Foundation, Durham Public Schools, and kind of a COVID update. That virtual town hall was in Spanish, Swahili, and English. And while our simultaneous interpretation did not work for Swahili, it went very well with Spanish, and we were able to do consecutive interpretation in Swahili, which was a historic moment for Durham because that had not ever been done before. In this roundtable, what we've been really working on is what are the things that we know the immigrant and refugee community really needs. Some of these needs are being met or are slowly getting there. The Community Health Ambassador program that the city and county have already funded is an example of work that has been needed for a long time, and a community ask that many folks have been advocating for. And so thank you all for helping put that idea forward. The next three ideas that we have come up with, I think, some of them may have been presented before, but then I'm not 100% sure on how you all have done your process. But the three ideas that we came up together as a group, and we operate in a consensus manner. So this is with the blessing and I guess votes from task force members, were continued support around bilingual and trilingual comms. And there was, I think, 70,000 dedicated in the CARES funding that the city got, but we just wanted clarification on that. We're unclear if Tilde's contract has been extended. And that was something we really, really wanted to see as a roundtable. So it may not need additional money, it just may need clarification on what has been already dedicated, but on our end, unclear as to what falls in that bucket. So hopefully that's not more money, it's just clarification on the funds that have been set aside. Secondly, and this is a prioritized list. So these were the kind of the three asks we had, and then what we thought was the most important. The second was more rental assistance. So the city received money from HUD that we then proceeded to give to the county, and between legal aid and the county, there is a rent assistance fund. We know it will not be enough. And so the second ask we had was $500,000 that is actually distributed to nonprofits who are already doing rent assistance, because we also know that that money can get into members' or residents' hands much quicker, because we all know that sometimes our governments, for many reasons, have to operate in ways that can kind of not get the cash as quickly into resident hands as we need it to. And this is something that Jesse Ramos, he's the one who pulled together the actual proposal that I think Ryan will share with you all from Legal Aid. Legal Aid has been a very close partner with the county. And so we really leaned on his expertise and what he is seeing as they see folks coming in because of eviction issues and many other things. And we know that there are several community partners, including the Central Church World Service. I think World Relief may also have a fund that are maxed out. We know that there are 100 people wait lists for these nonprofits. And so we felt that this was something that will be vitally needed. And based on the timeline I heard earlier, it will line up with probably the funding that is out there right now, with the county very much probably being, it will no longer be there, it'll have been used. And then the last item that we are proposing is, I think it's $300,000 for oxygen. And I always forget the second part of this word. They're basically oxygen monitors. Dr. Viviana Bianchi, who is one of the lead doctors in the group Latin 19, and has been just instrumental in the bridges between the Latino, both healthcare providers, the folks providing healthcare to the Latino community, and that who are also Latino themselves. She has been just a vital bridge between many places and people and groups throughout the whole pandemic. And so what she has seen and what other healthcare providers have seen is that with COVID, oxygen monitoring is becoming something that doctors are realizing and healthcare providers are realizing is an easy way to really monitor when people actually need to go to the ER. And this is something that we've struggled within the Latinx community. So people test positive and they're sick, but they are going to the ER very late in the game. And so then the care that's provided and the bill on the other end is a lot higher because they should have gone earlier. And so the at-home oxygen monitoring is an idea that they're thinking would help people really understand when they should be reporting to a healthcare provider sooner than when they're having pretty intense breathing issues and reporting to the ER. So those were our 3 requests. Happy to answer any questions anyone has or provide any extra background knowledge that somebody may have.
Any questions on those 3 proposals?
And we know y'all are going to get a lot of asks, so we wanted to get early in the queue. So I appreciate y'all's time this morning. I think Ryan will be sending the actual written proposals out. Again, this is, all of the proposals written and ideas are coming from Durham residents, on their own time. So super appreciative and thankful that we have such great resources and that folks are really coming together to help our immigrant and refugee community. And if anyone ever has any questions on why we make that distinction, happy to answer, what's the difference between an immigrant and a refugee. Technically, we're all the whole group we're all immigrants, but there are certain legal definitions given to refugees that are not given to others. And we meet every other Thursday at 4 p.m. So our meeting was not yesterday, but next week. And if anyone else in this group would like to join, happy to include you all and extend an invitation.
No, Javiera, thank you very much. I was just curious on the 3rd item you guys are proposing, just the thought from the medical professionals on the phone in general around the pulse ox monitoring. I know there's been a lot of conversation about that, how useful it is, how useful it is not. So I'm just curious in general, again, particularly from the health professionals on the phone, any thoughts around that?
Hi, sorry, I ducked my laptop here, so I lost my video, but so it's a good question, and I haven't been part of all of the conversations Ms. Caballero brought up, but my assumption here is this is targeting people that are known COVID-19 cases, and in that context, it may be helpful. I don't think the average person walking around needs to constantly monitor I think what you're referring to is a pulse oximeter. It's just a quick measure of the amount of oxygen flowing through you. And day to day, we all have about standard, and you don't want that. You don't want to measure it all the time because it's just going to go up and down and beep all the time. You don't need that. But for those that have COVID-19, I think it may be an early marker that things may be getting worse and you should get to your clinic or the hospital as soon as you can. So that's my understanding, and I hope you can either address if that's the conversation that's happened. So it's
that is the conversation that's happening. So within what we're seeing within the Latinx community, and I think immigrant community broadly, is that we represent a larger pool of underinsured or uninsured. And so these are folks who are getting tested, getting positive results, and then for many reasons aren't necessarily getting the care that they need. And so this is a way to help them make that decision on when they really need to report to a doctor, because what we are seeing are folks reporting to the ER and their symptoms are very, very then advanced, or the severity of their of COVID is very advanced. I will say with we've seen the overall, and it's great because the July numbers were terrifying, quite frankly, within the Latinx community. So we have seen that overall decrease, but with the rising flu and cold season, I think everyone on this call is anxious about the fall and the winter ahead of us.
I just want to jump in to thank Javiera. Thank you for all of your leadership, along with Pilar, on the Refugee and Immigrant Roundtable. The historic town hall meeting, Trilingual town hall meeting was amazing. And I know we've gotten requests to make it a 4-language one the next time, adding Arabic. So I'm sure that we will be Durham, and we will endeavor to do that. But I related to this question of the pulse oximeters, that's one of the things that really struck me when some of the residents who were part of the town hall spoke up. I heard people saying things like, we have COVID in our family. We don't know when are we supposed to go to the doctor. And it was very concerning to hear people talking about not knowing how to get resources or when to go. I was really concerned to hear people voicing that. I'm also wondering if the PRN, the Pandemic Response Network, if you all are getting plugged into that tool as well, because that is bilingual, and it is a way for people to daily self-monitor and then be in constant touch with Duke health providers, who can then say to people, you need to go get help right now, and this is where you need to go. So Javiera, have you all been connected with those folks yet?
Is that Mark
Sendak?
Yes. Thank you.
Yeah.
I have had conversations with him, and he is part of the Latin 19 weekly call now, but he has not come to the Immigrant Refugee Roundtable, and that may be something that we should discuss as a group. We just started having kind of a phase 2 conversation of what does the work look like now. And one of the things that we had talked about is starting to have presentations on different issues. And so thank you for that.
Okay, great. And I don't know if Jody knows this, and I know Rod is not on here anymore, but wondering with the state budget, was there anything in there related that could help with, like the request for the pulse oximeters, or any resources that we may be able to plug into at the state level that was just approved?
Good morning, everyone. I'm not aware of anything specific. Certainly can follow up with Rod to see if anything from the Department of Health and Human Services has anything that might be coming down. But the additional money that the General Assembly appropriated, I don't believe looked at any of these areas. So we'll have to do some additional research.
Madam Chair, so what is the process now that we've heard this? What is your thinking about how we're going to move ahead with these?
So what'll happen is, so as I alluded to, and we had a subcommittee that we pulled together the last time, and that subcommittee included myself, Katie, Pilar, Ibukun, Jim Groves, because I think Jody, you were on PTO, so I pulled Jody in this subcommittee, and we had also invited Anthony and Geoff, but they were unavailable. So my recommendation for that broad group is we would meet on Monday, because we have, if we're trying to get this moved forward, everything needs to be ready by September 22nd. So we would meet on Monday to vet the proposals, so to take a deep dive in the proposals, make sure that they're aligning with the mission of the task force, do that vetting. And what we found the last time we pulled together the group, we were able to get through all the proposals that evening and rank them and came out with a recommendation. So I would say by Tuesday, we would have a recommendation that we would bring forward to the task force, for the task force to vote on. And hopefully by Friday, we'll have a decision on the proposals that we want to move forward. So that's the process that we would follow.
So it would be back in front of us in a couple of weeks.
Back in front of the task force. Well, by the 25th, we could talk about it some more at our meeting on the 25th, but our hope was we would handle this via email in terms of which recommendations we want to move forward, because we don't have a meeting next week. Yeah.
Right. Good.
So, yeah.
That sounds great.
All right.
Thank you very much. And Ryan has the detail. I think Javier said.
Yes, he has all the written proposals.
I'm working on having them all formatted to send out to the task force.
Great, thanks.
Right. Thank you so much.
So we only have 3 minutes left, but we haven't talked about the Ppe Warehouse. I can give a very brief overview. This idea is related to something that we've already brought before the task force, which was the idea of a risk mitigation fund, a grant fund to support Durham establishments in purchasing things that are evidence-based and reducing the risk of COVID-19 transmission for their employees and customers. When we presented that idea to our elected bodies, one of the suggestions was that we go back and think about which of these needs could best be met, not through a small grant fund, but through a type of local centralized warehouse where our government could, through the benefit of making a larger purchase, perhaps get a better price than our individual businesses could on their own. And it would also just be administratively easier than administering a small grant fund, both for businesses who, from what we have heard in some of our additional meetings, have a lot on their plate, and the idea of applying for a small grant is a little less appealing than finding some other easier mechanism for meeting some of these needs. So since that time, I've been working closely with Brian Smith and OEWD, and we have engaged Duke Health and TROSA in an idea developing a proposal around a PPE warehouse. This idea would focus on a few critical PPE needs, and I'm going to say Durham establishments because we're thinking of this as something that would serve not only businesses, but also nonprofits and places of worship who could benefit from this. The idea is for an initial pilot that would serve up to 1,000 Durham establishments that would provide a centralized location where establishments could pick up free face masks, hand sanitizer, and for specific industry types, face shields, where we think that could make a difference. We have gotten in, so Duke Health, I had a great conversation with them that Katie set up. They have agreed to help us source all of these items at the rates that they can get, which is a tremendous resource, and to store them for us in their own warehouse. The idea is that TROSA would then be able to pick up those items and use a central delivery distribution place where their staff would handle distribution at set times that we are finalizing with them. There's a couple of key decision points, and we are at time, so we might have to follow this up by email. But one of the key decision points is for employees. So if we're creating these PPE kits, for the face mask for employees, there's the option of them being either disposable face mask at roughly 30 cents per face mask or cloth reusable face mask. Cloth reusable face masks are more expensive, but there could be some benefit for employees having reusable cloth face mask, 3 per employee. And then we would have a separate set for customers. Those would be all disposable. It'd be 50 disposable face masks per business. But I think one decision point is, I'd love, and maybe I can follow up with Dr. Akinboyo as a separate in a separate email, is whether or not we think it advisable for employees to provide cloth reusable face mask and reserve the disposable face mask for customers. And then a second follow-up question is, if we think cloth reusable face masks are a better route, do we think there's a decision point around sourcing those at the best price for a quality face mask, which Duke has quoted us at about $2 per cloth face mask, or sourcing them locally through some of our providers on Durham Has You Covered. And I think the best price that we could probably get there is about $3.25 or $3.50 per mask. And so you can see would be a big cost difference, but we'd be able to source them locally potentially. And so those are some of the decision points that we still need to figure out. And I am waiting on an estimate from TROSA for what it would take to staff and administer this program. So those are some updates, and I know that we're out of time, so I'm happy to follow up with any of you or take questions offline.
Thank you, Ryan. So it sounds like we have about 4 budget proposals that we're going to evaluate to move forward. So again, I'm going to send an email out to the subcommittee to see who's available to meet on Monday so that we can vet these. Task force members, be on the lookout for an email that we will send out with our recommendation. Hopefully, I'm hoping by Tuesday we can get a recommendation out for you to react to give you time to ask any follow-up questions, and hopefully by Friday we'll be able to land on a decision on what we want to bring forward, because again, we won't meet next week. Our next meeting is scheduled for September the 25th. So I'm appreciative of all that everyone on this task force continues to do to support our efforts. And I hope everyone has a fabulous weekend, and look forward to communicating with you via email next week and actually seeing you virtually in 2 weeks. So everyone enjoy the rest of your Friday. Bye-bye.
Bye. Have a nice weekend.
Thank you. Goodbye.